Hi there, I'm Michele Zielinski, a 10-year survivor of muscle-invasive bladder cancer and the volunteer board chair for Bladder Cancer Canada. As a survivor and longstanding volunteer with BCC, I know firsthand what a difference support makes in this journey, especially when it comes from those who have been there and done that. BCC remains the first and only national patient-focused bladder cancer organization in Canada. And as a registered charity since 2009, we're committed to a pretty ambitious vision: to create a world in which bladder cancer is just a memory. Our vision is threefold: to support bladder cancer patients and the broader bladder cancer community, to increase awareness and education about bladder cancer and Bladder Cancer Canada within the general public and the medical communities, and to fund and promote research. Our ability to do this is enabled by the power of dedicated and passionate people across Canada, our many volunteers, the broader healthcare community, industry, and our small but mighty staff team. It's also enabled by the power of philanthropy. As a 100% virtual organization since its inception, BCC's support and education and awareness programming continues to reach a wide audience, virtually, online, and in person. We have trained volunteer patient support, capacity, and capability in both English and French. Patients just like myself with experience in non-muscle invasive bladder cancer, muscle invasive bladder cancer, metastatic disease, and clinical trials, who are all available one-on-one or in groups. Our live and recorded webinars and podcasts focus on current medical research and supportive care topics, such that patients have access to reliable and relevant information at all times. Our See Red campaign with the lemon squeezing red continues to run on digital screens in doctors' offices and on billboards in large urban centers across Canada. Through paid and mostly donated advertising space, that powerful visual appears in transit shelters and even restrooms. And we've heard numerous times how this messaging has literally saved lives, prompting others for early diagnosis by patients who saw red and saw their doctor. Our annual awareness and fundraising walks, Canada Walks for Bladder Cancer, brings people together across the country each September through virtual and in-person events to remind patients and families that they are not alone in this journey and to bring awareness for early diagnosis and access to support. With committed and expert clinical practitioners and researchers working alongside us here at BCC, we have so far committed $2.8 million to bladder cancer research since 2012. With over 80,000 people living with bladder cancer in Canada and an expected 12,500 being newly diagnosed each year, our commitment grows ever stronger. I invite you to join us here at BCC. Check out our website at www.bladdercancercanada.org to see the many ways that you can connect with us and get involved. Together, we can make a difference and create a world in which bladder cancer is just a memory.